Hi there, everyone. It's finally Friday. Hope everyone's having a good Friday and looking forward to some really nice weather. It looks like over the weekend. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today's Friday, September 10th. I am here to give you the update of our COVID-19 pandemic. So we have 892 cases that were reported yesterday, and that was another spike of a backlog of laboratory results that were reported by a single healthcare system that has 2 urgent care clinics here in Mobile County. So 659 of those positive laboratory results that were reported to us occurred in the past. So about at least 233 were not. So our official count from yesterday is probably somewhere between 250 and 300 if we eliminate the ones that were processed due to the backlog of results. Hopefully, I don't know, but hopefully that will be the last dump that we get from this agency. It really sort of complicates things and confuses people sometimes, but at least we can look into it and explain it. So a total of 1,117 people have died with COVID-19. 9 additional deaths were reported to us yesterday. The cumulative number of people hospitalized stands at 8,327. 35 additional admissions were reported to us yesterday. The number of people in the hospital yesterday with COVID-19 went down again. That's really good news. 2 thumbs up. 275. So that, again, seeing those counts under 300 is really good. Seeing it going down is really great. We want to get it down to the low double digits that we were seeing in June. So we're not out of the woods yet. Our hospitals are still in a precarious situation, coping very well. But again, just doing, pulling out all the stops to retain staff, to keep staff and, not just nurses and doctors, but cafeteria workers, janitors, allied health workers, that sort of thing. Trying to keep everybody going because they are stressed and tired and deserve our continual thanks for the work that they're doing. So I will talk a little bit about a few announcements that we have. Let's see. One is, yesterday we talked about a health alert network that went out to lots of folks around the state. Most of that information was rebroadcast today in the form of a news release from the Alabama Department of Public Health, so probably went out more widely than the Health Alert Network did yesterday. It talks about monoclonal antibody products that are available for some high-risk COVID-19 patients and some who have been exposed, but they are not a replacement for vaccination. So again, vaccination is the best primary prevention tool that we have. We want to prevent infections before they happen. We don't want to have to rely on treatments to help eliminate infection or cure us after we get infected. The best thing to do is to prevent infection, and that's through a vaccine, wearing a mask, and keeping your distance. If you do get COVID and you meet some pretty stringent criteria, then you may be eligible for a monoclonal antibody treatment. The one that we've been using at the health department, I think yesterday I called it Regeneron, but it's not. It's called RegenCove. So sorry about that. That's the one that you can use through a subcutaneous injection. It does not require intravenous infusion. But again, recently, the Department of Health and Human Services announced that monoclonal antibodies, there are 3 different versions of those that are available, are temporarily under allocation and must be tracked by healthcare providers to ensure they are distributed where they're needed. And again, not everyone qualifies for this, out of the hospital patient treatment, and healthcare providers are being asked to review the criteria for administering them and prioritize patients that are at the highest risk for progression to severe COVID disease. So when we have a limited supply of a treatment, or when we had a limited supply of vaccine, We wanted to prioritize the people who were at highest risk of severe disease and potentially death when those things are not flowing freely. So right now, on a temporary allocation. So talk to your healthcare provider about, if you test positive for COVID, talk to your healthcare provider to see if you are eligible to receive either an intravenous infusion or a subcutaneous injection of one of the 3 types of monoclonal antibodies that may be able to have been shown to prevent hospitalization and severe disease and death in people who are at risk of those very severe outcomes following a COVID infection. All right, a couple of questions. Let's see, someone asking about herd immunity. How much protection does natural immunity, sorry, not about herd immunity, about natural immunity, asking about how much protection does someone actually get from a COVID infection? So if you get a COVID infection, your immune system will naturally try to fight off that infection, which provides some immunity, some level of protection should you be exposed again to COVID. Right now, all of the data and the science that are being produced and evaluated by the Centers for Disease Control indicate that you are very unlikely to get infected again within 90 days of a primary infection. So when you get an infection, you will have some level of protection probably for at least 90 days. So again, protection is pretty good in the first 90 days. Beyond that, there's very little conclusive science and data around how long, because as you can imagine, when you get a natural infection, everybody gets a different dose. Everyone reacts differently. There's no clinical trials going on, worldwide or US-wide, sort of looking at natural immunity. There are some, and based on what we are seeing, we only are giving you about 90 days to presume that you are protected from a second infection. So natural immunity does not provide the same level of protection or the same duration of protection as a natural infection or natural immunity does. Another question, does the health department offer monoclonal antibody treatments? We do offer monoclonal antibody subcutaneous injection, the REGEN-COV product, for our patients who are tested at our locations. We can refer those internally. It's, again, not a given that anyone who tests positive gets the antibody treatments. It is there are a very small number of people who meet the criteria and then that are willing to receive that monoclonal antibody treatment. We have just begun providing monoclonal antibody treatment internally, and so if we realize that we have capacity to take referrals from providers out in the community, we will let you know. And then a question about, is the federal rationing of monoclonal antibodies that was announced by ADPH going to impact us here? There will be some impacts. I think that many providers that are giving monoclonal antibodies in Mobile County have the supply to meet the current demand, but I don't know what demand is going to look like going forward. So it's a little bit of a tricky game to try to order just as much as you need and not anymore, so that you're not cut off from ordering by having some sitting on the shelf for weeks or months at the time. I think the antibody treatment it has a longer shelf life, seems like, than like the vaccines. When we first got them, it seemed like they had a 3 to 6 month shelf life, and then the shelf life has been extended. I think the shelf life for the monoclonal antibody treatments are longer, and the storage requirements for those are not as stringent. So they're easier to store. They can be kept in refrigeration longer. So it may be that, I know for the health department, the supply that we have on hand, I think will be sufficient for quite a long time. All right. I was asked earlier today, and this is probably a question that's going to come up by others, so I'm going to answer it again. Lots of people are asking me about, what we're doing, considering the announcement by the Biden administration last night to potentially require vaccination for employers with 100 employees or more, and if you're not vaccinated, to test. Is that going to increase demand for testing and vaccination? And how is the health department planning for that potential increase? And my answer was, we are always in planning mode. We have to be nimble and adapt to the situation at hand. So, in the spring, we were running mass clinics. We were doing them at the cruise terminal. We were doing them in parking lots because we were getting as many people through on a daily basis as we could. When the demand for vaccine began to drop off, then we changed our model and went to doing more smaller events around the county so that we could reach the outskirts of the county that weren't served by our big clinic down at the cruise terminal. Since the end of summer, when COVID started ramping up, now we have this huge demand for testing. So we have pivoted again now to identify a couple of spots where we can do both testing and vaccine at the same location. That is going very well. And we have been planning for a location, trying to find a location where we could do larger numbers of people on a daily basis so that we could consolidate our staff in one location. And this is, this preparation, this planning for how we would handle a third dose if it were approved, or when it's approved, will come in handy now that it looks like the president is going to be requiring vaccination. So that's what the Mobile County Health Department is doing, is just continually planning ahead to try to adapt to deal with the outbreak in whatever form that we find it in the next couple of months, ahead of us. So it's kind of like preparing for the hurricane. You just want to be ready. So if the storm shifts to the left or the right, you can react appropriately and find yourself on higher ground. So that's what we do as well. Have plans, backups to the backups. What the state health department is doing is trying to continue to onboard more providers as COVID vaccinators. So there's a process that you have to go through to be approved to give COVID vaccine, and the state health department has been working to onboard additional providers. And this is a multifaceted network of vaccine providers. So it's not just the health department, it's not just pediatricians, it's not just the USA drive-throughs that are still going on at the Civic Center. We also have pharmacies. We have grocery stores who have pharmacies in them. We have Walmart who have pharmacies. So a lot of different providers, a lot of businesses. I know several large businesses in town that have worked to become COVID vaccine providers so that they can vaccinate their own employees. So it's just a large network of people who can give COVID vaccination, so that hopefully, if boosters come around, or if a federal mandate to get vaccinated comes around, we'll be able to pivot our strategies to adapt to that new environment. All right, there are a lot of questions, interestingly, about flu season. So I talked about that a day or two ago, about that the ACIP recommendations for getting a flu shot are out, and everyone, I think 6 months and older, needs to get a flu shot this year. So the questions are, there's a whole big old long list, and there is an image right here that provides some trends in what flu season has looked like, what it's looking like this year, what it's starting to look like this year compared to the last 2 years. So generally we think about flu season as being about October through April, give or take. So you can see on the chart, I do have a copy of it. So the yellow line shows the flu season 2018 to 2019, which was a fairly typical flu season where we see most of the cases occurring after the first of the year. So generally, in February, March, April, that sort of thing. 2019, 2020 was a really bizarre flu season. I don't know if you guys remember this, but we saw this big spike of influenza B in the fall of 2019, and then it dropped off around the first of the year, and then we saw the second spike that was A and B, sort of in the traditional flu season where we see the peaks around, like I said, March, April, May, that sort of thing. So this past year, 20 to 2021, you can see that green line, we had almost no flu season last year. And we attribute that to, school's out, people are wearing masks, people are distancing, they're doing all the things that they need to do to try to prevent, COVID, the respiratory virus COVID, from being transmitted person to person. And by doing so, almost completely eliminated person-to-person respiratory viral transmission of the influenza virus. So that was really interesting. And then if you look around week 19, you see that spike in that green? That's when the mask mandates came up. And when the masks came off, we started seeing respiratory viruses flourishing, and we saw that spike, after season spike in respiratory viruses like flu and like RSV. So if you look out there at week 35, that's where we are now, coming up on the end of the 2020-2021 flu season, you can see that influenza-like illness, emergency department visits for influenza-like illness are higher right now than they were the previous two seasons. So we will continue tracking that. Let me see if there are some other specific questions that I can look to. Just showed that. There will be a big push to get flu shots every year, not just last year or the year before, but every year. So we will be encouraging everyone who is eligible to get a flu shot. Let's see. Can someone get COVID and flu at the same time? Yes. It is possible to get COVID and influenza at the same time, COVID and RSV at the same time, enterovirus and COVID at the same time. So we need you to get your COVID and your flu shot. And you can get them at the same time. And then I think someone just noting that, our healthcare systems are overwhelmed. Doctors' offices, emergency departments, urgent care centers. So get a flu shot if you can. Get a COVID shot to give our healthcare system a breather, so that if you are in a car wreck, or if you have a cardiac event, or if you have a fall, that you will be able to get the emergency care that you need and get a bed if you need it. All right. Someone asking, okay, I think that's all the immediate questions unless there are any more. Okay, so on to some Facebook questions. So someone saying 10 days symptom-free for isolation. Yes, that is right. Isolation is for people who have a COVID positive test or who are sick with COVID and they had been exposed. We just assume that they're positive. So if you live in the household with someone who has, laboratory confirmed COVID and you get sick, you have COVID. We don't need a positive test for you. You have COVID. So either from symptom onset or your positive test, 10 days of isolation, that means being at home, not around anybody, and that lasts for 10 days. On the 11th day, you can resume normal activities as long as you have no symptoms, you're fever-free, and all of your other symptoms have improved to normal the last 24 hours. If you've had COVID, can you catch it again? Yes, and you could catch it a third time potentially, and maybe even a fourth time, depending on how long this outbreak lasts. So yes, you can catch it time and again. And the question goes on to say, and do you have antibiotics? There are no antibiotics that treat COVID. Now, sometimes when people get sick with COVID, they develop sinus infections or pneumonia, things of that nature, and sometimes antibiotics will be prescribed to try to prevent those things from happening. But antibiotics do not treat COVID. Is MCHD administering third doses? We are administering third doses to those who qualify, third doses of Moderna or Pfizer. And remember, those people who qualify right now, who qualify for the third dose that's been authorized, include receiving active cancer treatment for tumors or cancers of the blood, received an organ transplant or taking medicine to suppress your immune system, have received a stem transplant within the last 2 years, or taking medicine to suppress your immune system, moderate or primary immunodeficiency, advanced or untreated HIV infection, and active treatment with high-dose corticosteroids or other drugs that suppress your immune system. So at the health department, what we are going to ask you is to sign a test that you meet one of those criteria. We're not going to ask for your doctor's note. We're not going to ask for your medical records. We're going to ask you to check the box that says you meet one of those, and then we'll ask you to sign that, and we'll keep that paperwork on hand. Okay, if you get a third dose, can you take off your mask? No. Transmission in our community is too high right now. Regardless of vaccination status, everyone should be wearing a mask. How soon can people with underlying health conditions get another dose? This is still up in the air. So again, the White House, the Department of Health and Human Services, set a goal for September 20th, told the manufacturers, we would like for you to, try to be ready to authorize third doses by the 20th of September. Look at the data, look at the safety, look at the effectiveness, and let's try to give authorized third doses by September 20th. So far, that has not happened yet, but we're still, 10 days away. So who knows? It may happen. We're still just sitting back and waiting. But what will happen is that there will be some time frame, right? So they'll say okay, everyone who, you have to wait until 8 months after your primary series was complete before you get a secondary series or a booster shot. So everyone won't be eligible at the same time. It will depend on how many months ago you completed your primary series. All right, when can we expect a spike from the Labor Day weekend? So we talked yesterday that the incubation period for COVID is 2 to 14 days. So for everyone who was infected over the weekend, it's going to take them 2 to 14 days. That's the window that we say, if they're going to get sick, they're going to get sick during that time period from 2 to 14 days. So that means that we'll keep our eyes open until at least 2 weeks from Labor Day, which will be September 20th. So someone's asking that I guess they have a child who's not old enough to get the COVID vaccine and goes to a public school, and this Facebook viewer is asking if I recommend him to get tested for COVID every now and then, or should I only do if he shows symptoms or has contact with someone sick. This is a really cool question because, whoever wrote this recognizes that their child is at risk, and probably the only way they can protect their child is to, the family get vaccinated, send the child to school with a mask. But another thing they can do is test the child to see if the child has asymptomatic infection. Because if the child comes home or goes to grandparents or goes to a sleepover and the child has COVID and doesn't know it, he or she could be, transmitting COVID and not realizing it. So there's no harm in testing your child on a regular basis, either with a home testing kit or, going to one of the clinics around town. There's certainly no harm in doing that. And if he or she is in a classroom where maybe the teacher's not vaccinated or lots of people are not wearing masks, it's not a bad idea to what we call surveillance testing. So do surveillance testing on your child and keep them home if they test positive. Should pregnant women get a booster now? Not yet. Unless you are moderately or severely immunocompromised, those are the only people who should be getting a third dose now. All the rest of us, we're just going to have to wait for the guidance to come out on whether or not a booster is going to be recommended this fall. Okay, vaccine events. I wanted just to talk about a couple of things. Don't forget, I announced this yesterday and I want to reiterate this. Free testing can be obtained at the Mobile County Health Department. Go to mchdcares.com to see where. Quickly, our Cox Street location, 248 Cox Street, 7 days a week, Monday through Friday, 9 to 7, Saturday, 10 to 6, and Sunday, 12 to 4. At our downtown location, our Keeler location at 251 North Bayou, that is Monday through Friday, 9 to 3:30. You can get a free test, you can get a free vaccine, walk in, no appointments. Be prepared to wait a little bit. Sometimes we're very busy. But the other great thing is that there is now free testing at 3 CVS locations in Mobile. These are drive-through COVID testing at no cost. Results come to you approximately in 1 to 2 days. It's a drive-through process. The staff show you how to swab. You swab yourself, stick it in the tube out your window, right? And swab yourself under the supervision of skilled staff or trained staff, and then you'll get your results in 1 to 2 days. So I just want to remind you where these locations are. 3100 Dolphin Island Parkway, the CVS at 3100 Dolphin Island Parkway, the CVS at 4645 Airport Boulevard, and the CVS at 900 Government Street. You have to go online to register for an appointment, but it is no cost to you. And then the last COVID-related thing that I wanted to mention, we have a vaccine clinic planned tomorrow at a health and wellness fair sponsored by the Emmanuel AME Church Helping Hands Ministry. It's located at 1114 Spring Hill Avenue. It's an outdoor area next to C&M Tax Service. So that is going to be tomorrow from 10 a.m. to 12 p.m., free Pfizer, free Moderna. And it just happens to fall on the 20th anniversary of September 11, the attacks on the World Trade Center, the Pentagon, and the plane that was destined for the White House that came down in Pennsylvania. So today at the Mobile County Health Department, we're observing Patriots Day, and in honor of everyone who lost their lives in the tragic events of 9/11, 2001. And our hearts go out to the family members and friends and coworkers who lost individuals. I'm wearing my Memorial 9/11 t-shirt. I deployed to Lower Manhattan as a CDC employee during the anthrax attacks following the 9/11 attacks. And it was just one of the most amazing experiences of my life as a public health responder and a CDC employee. So just wanted to say to everyone, please take some time to reflect and hug the ones that are still around you, and take a moment of silence to think about everyone who was affected by the tragic events of 9/11, 2001. So I'll leave you there. Next week, we're going to go back to Monday and Thursday Facebook Live events. So we'll see you Monday at 2:30. Have a great weekend, everyone.